Hi, my name is Harpreet, and this is a Foley Catheter insertion setup video. So I'm going to begin by determining whether there's an order for the patient for administering a Foley Catheter. I'm also going to determine whether there's any contraindications for inserting the Foley Catheter in the specific patient. At that point, I'm going to go to the patient's bedside, gain privacy, identify them by two identifiers, their first and last name, and their date of birth. And I'm also going to explain the procedure to the patient, and I'm going to explain the reason why the Foley catheter is being administered. I'm going to gain consent. I'm going to raise the head of the bed to a good working height, and I'm going to perform hand hygiene and apply clean gloves. I'll then examine the patient by palpating their bladder for distension. I will then help if it's a male patient, help them into a supine position with their legs extended and their thighs slightly abducted. I will then cover the upper body with a bath blanket and also drape the lower body with a separate bath blanket or sheet. I will do so in a manner that only the perineum is exposed. I will ensure that there is a waterproof pad under the patient. The perineum will then be washed with soap and water and then rinsed and dried. While still wearing gloves, I'll identify the patient's urinary meatus, and I'll remove and discard my gloves and at that point perform hand hygiene. I will then remove the outer wrapping of the catheterization kit. I will do so in a manner that maintains the sterility of the inner wrapper. I will then place the tray of the inner wrapper catheterization kit on a clean surface, or if possible between the patient's legs. I will then open the sterile wrapping of the catheterization kit while only touching the outer edges. I will then apply sterile gloves. As you can see, these gloves are size too small, maybe two sizes too small. I'll at this point pick up the square drape and allow it to unfold without touching any unsterile surface. I will then apply the shiny side down on the patient's below the patient's perineum. I will then pick up the fenestrated drape and apply it to the patient's perineum, so only the genitals are exposed. I will then place a sterile tray on the sterile drape, and the tray contains cleansing medium, it contains lubricant, and it also contains a syringe for injection of the fluid that inflates the catheter balloon. It contains cotton balls and obviously the catheter. I will and forceps as well. I will open the sterile antiseptic solution and pour it over the cotton balls at this point. I will then open the packet of lubricant and squeeze it onto the sterile field. I will then open the inner sterile wrapper of the catheterization kit. The catheter is already open, but I would do that. I will then apply lubricant, dipping the tip of the catheter into the water-soluble gel 5 to 7 inches, so that 5 to 7 inches from the tip of the catheter are lubricated. Thank you.